Welcome to Ask Dr. Geier Live. It is that time every week where I answer your questions wherever you're watching, wherever you're, well, I guess you're not listening. This is only by live show. There's no podcast version of this. My name's Dr. David Geier, triple board. I'm not used to that intro yet. Triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I am a little flustered. Right now, Hurricane Ian is on top of Charleston. It's actually about 20 miles north of Charleston, but it's hitting onshore right now, 12 p.m. I opened my door. I don't know if you can see that. It'll look more impressive here in a minute. I don't know if you can hear that. My mic doesn't really pick up stuff from surrounding areas, but it is loud, the wind. So I apologize. I would tell you, you may want to get your questions in soon because our power's been going in and out for the last hour or so. So this may end through no fault of my own, and I apologize. So I am not going to waste a lot of time. Please remember, I am not giving you medical advice in Ask Dr. Geier Live. Just like all my videos, just like all of my live streams on my website, this is meant for general information and educational purposes only. All right, Christian Gutierrez, glad to have you. It's a new name I haven't seen before. Why are patellar tendon tears so stubborn to heal, even if it's just a small tear? So I'm assuming what Christian is talking about is not a complete patellar tendon rupture. This is the tendon. This is the tendon just below the kneecap. If that is torn completely across, which I'm assuming his is not if he's talking about it being a small tear, that needs surgery. There is no non-surgical treatment of that because even if you casted somebody in full extension to try to get it to heal, it's very likely going to re-rupture, and then the knee gets ridiculously stiff. That's just not an option. But you can have small tears within it. You know, what starts as like a patellar tendonitis turns into patellar tendinosis, and then sometimes you can even get a small tear there. It doesn't typically heal very well because there is really poor blood supply to that area. Sorry, I'm watching the trees in the background. There's really poor blood supply to that area, and there's a lot of stress that goes through the patella tendon with normal activities, walking, jogging, jumping, things like that, and it can be really tricky. You can't inject cortisone in it, cannot inject cortisone in it, because that can weaken the patella tendon and increase the chance that it ruptures. Physical therapy can help by strengthening the muscles around the knee to take pressure off that area, but a lot of times doesn't get it to heal. So that's where some of the newer treatments, the anti-aging and regenerative medicine treatments, are probably starting to step in. Peptides like BPC 157, maybe thymosin beta 4. I'm not as sure on tendon healing properties with that, but potentially. Where you think of things like platelet-rich plasma injections into the tendon, maybe even exosomes. So those are always options. And then sometimes, albeit it's a monster surgery or a monster recovery from a little nothing surgery, where you go in and open up that area and just cut out the diseased part of the tendon and then sew it back together. That can work, but it's a surprisingly long recovery and has a lot of pain after surgery. Hope that helps. I don't even know your first name, so I'm not going to try. Distal femur, comminuted fracture, 5 months have passed, bending knees, 20 degrees, bones not healing, reductures not good. Should I need surgery? Again, this is not medical advice, so I am not going to tell you what you should or shouldn't do. Having said that, distal femur fracture is the end of the thigh bone. So you're looking at the knee, femur, tibia. Femur's the thigh bone, tibia is the shin bone, the end of the femur, distal femur, right above the knee. Comminuted fractures, doesn't sound like the reduction is good, meaning it doesn't line up well. 5 months out, really unlikely that, I mean, granted, I'm not seeing x-rays, I haven't examined you, but I would assume that's a pretty good sign it's not going to heal and typically needs surgery where you kind of go in, clean up the scar tissue that has filled in the fracture site, and then hold it in place with, there's a variety of different plates and screws that can do that. It's a big operation. That is going to be necessary, yes, for in that scenario at least, to get the fracture to heal, but also because it's very, very hard to bend the knee when part of it is not stable, and so it really makes getting motion back. That may be a problem even after surgery. Once the knee gets stiff, and that's 5 months is a long time, it's very, very hard to get knee motion back. You can do surgeries where you remove scar tissue, and you can do these devices like continuous passive motion, these machines that sort of slowly bend your knee back and forth for hours and hours, but really kind of a tricky problem. And Jamie, what would they do since I might need surgery? I must have missed your first question because I don't know what, oh, no, that's not you. What type of surgery that is to tell you. So if you want to give me more information, Jamie, I'm happy to try to answer. Muhammad, ACL surgery, February 1st. What is that? So we're about 8 months out. Got back to training June 4th. That sounds about right. After not so vigorous run, knee gets very sore for a while. Any advice? Also use knee guard while running. Again, not medical advice, but you do see that a lot of times. People, maximum medical recovery from an ACL surgery, just so people know, I think the pro athletes have skewed people's opinions of it, but maximum medical recovery is somewhere between a year and 2 years. That's why you're seeing pro athletes now, the teams are holding them out for 9 to 12 months after surgery. See, the power just flickered, so we may be in trouble here. So this may be it on questions. But the big thing is getting your quad strength back. Physical therapy, somebody that really rehabs a lot of ACLs, a physical therapist that does sports medicine and works with a lot of athletes is really the best way to do that. Getting that quad strength takes the pressure off the joint. It tends to hurt much less and helps you get back to the activities that you do in your sport. And then real quickly, this is going to be last because it's got to be. Another question, what is the difference between tendonitis and tendinosis? Tendonitis, and this applies to lots of different tendons. The Achilles tendon is another good example. Tendonitis, in theory, is you get a small area of inflammation in the tendon. Normally, that's fine. It goes away pretty quickly. But if it doesn't, you can actually get a small area of degeneration in that tendon. That is a much more tricky problem to get to heal. That's where there aren't really many other options other than what I talked about. I know the chiropractors and some people used to do prolotherapy where they injected sugar water into it. I don't know necessarily that I would do that if you've got PRP, which is a fancier form of prolotherapy where you're injecting basically your plasma with its platelets and growth factors to try to get it to heal. But again, things like BPC, exosomes may become some of the common treatment threads. All right, I'm not going to go real long into this because I need to go, but if you do want to see me as a patient formally, the link to my website is below, drdavidgeier.com. Go to the contact page, fill that out. That gets to me and my assistant, and we will work on setting up basically a one-time in-person or video consult session to see, basically then I can outline treatments and that kind of thing. And then if you decide to do that, you come to our office right outside of Charleston, South Carolina to do that. I no longer go to Charlotte anymore. Having said that, I am happy just about every Friday to be here to see you and answer questions. Again, not medical advice, but give you a little bit of information that hopefully then you can take to your doctor, your orthopedic surgeon, and get information and make the best decisions for you. I hope everybody out there stays safe. I hope you have a fantastic weekend, and I will see you next week.